Welcome, friends. A woman entered our labor and delivery ward last week, visibly high, and she had no idea that she was in labor. When we got her baby on the monitor, we noticed that the baby was in fetal distress. And when we got the drug screen back, we found out that the mother was high on heroin, barbiturates, and methamphetamines. Today, I'd like you to listen as Christian parents with a heart of love and mercy. I've been in the healthcare field for 10 years. In the last year and a half, I've been working in labor and delivery, and I've seen this scenario play out countless times a day. Millions of babies are born addicted to illegal substances due to the fact that their mothers do not have the education or support system to break their addiction. But with a combination of support, networks, and early detection, we can rehabilitate these mothers and save their babies from the pain of withdrawal and possible death. Today I'd like to talk to you about addiction in pregnancy, the long-term effects on the mother and the baby, and my proposed solution. The first issue I would like to speak to you today about is addiction in pregnancy. Not only is it harmful for the mother, but it is also harmful for the baby because the drugs pass through the placenta and the umbilical cord, which is the baby's lifeline. This causes birth defects and addiction. The effects to the fetus are greater because the drugs remain in the bloodstream for a longer period of time, and this disrupts the growth cycle. If addiction is fed through the second and third trimester, the mother is more afraid of the consequences of confessing that she may forego prenatal care. In her article, Dealing with Addiction While Pregnant, Lori L. Duggy tells us that research shows that women who are afraid they'll be prosecuted or have their children taken away are less likely to seek prenatal care or treatment for their addiction. Next, I'd like to talk to you about the difficulties faced by mothers and babies. Babies that are exposed to highly addicted drugs such as cocaine, heroin, methamphetamine have been shown to display withdrawal symptoms as soon as 2 hours after birth. The American Academy of Pediatrics has extensive literature on the subject, and in their article, Prenatal Substance Abuse, the Short and Long-Term Effects of the Exposed Fetus, Dr. Banke and Dr. Smith tell us neonatal abstinence syndrome includes a combination of physiological and neurobehavioral signs that include feeding problems, diarrhea, irritability, increased muscle tone and activities, and seizures. Infants with neonatal abstinence syndrome often require prolonged hospitalization and treatment with medication. Lawmakers in many states are considering jailing mothers of babies who are born addicted. In her article, Michelle Willard tells us that expecting mothers who use illegal drugs may become a subject to criminal prosecution as part of a renewed push to address these issues. Now I'll turn this discussion from the problem to my proposed solution. There are programs through the National Drug Hotline and National Alcohol and Drug Dependence Hotline, but I would like to support system more on a community level. Since it is proven that an inpatient recovery process is the most successful, I would like to make a special home for these mothers to be admitted for a recovery period. This process would include a gradual withdrawal from the addiction, but also an extensive education program and support matrix. I would also like to provide family planning and initiate a long-term pediatric care program to assess the care for the newborn and any other children born to program patients. And so, today we discussed the problem with addiction in pregnancy, the long-term effects of addiction on the newborns, and what our country is doing with these social problems. And then we spoke of my proposed solution to this problem. We must place a support and education program in place to encourage and strengthen addicted mothers in their recovery and save millions of babies from the effects of addiction and withdrawal. Our duty as Christians in our community and to help and support these families. Thank you.